Constipation is a feeling of incomplete bowel emptying in a person for more than 48 hours in the absence of defecation or in the presence of defecation. In a healthy person, the frequency of defecation depends on nutrition, habits, and lifestyle. People suffering from constipation often complain of chronic fatigue, unpleasant taste in the mouth, nausea, and decreased appetite. Those suffering from constipation have a swollen abdomen, unhealthy yellowish-brown skin, and due to frequent use of laxatives, intestinal absorption is disrupted, resulting in mild anemia and vitamin deficiency. Constipation affects 20% of the world's population, mainly in developed countries. The problem of intestinal dysrhythmia is relevant for all age groups. Constipation often develops in people up to 25 to 40 years old, and later this problem intensifies. Constipation in the fertile, reproductive period is characteristic of women. Constipation in elderly people occurs almost 5 times more often than in young people. Such recognition is recognized by many researchers dealing with age-related gastroenterological problems. In clinical medicine, organic and functional constipation are distinguished. 1. Organic constipation. It develops due to intestinal morphological and anatomical changes, often diagnosed in childhood, or pathological and iatrogenic causes, with almost equal probability in young and middle-aged individuals. Organic constipation is caused by the following factors: congenital anomalies, dolichocolon, dolichosigma, colonoptosis. Complications of intestinal surgical operations, inflammatory process in the intestine and omentum, invagination, disruption of the omentum, intestinal torsion, intestinal obstruction, compression of the intestine by cancerous tumors in the intestine or surrounding organs. 2. Functional constipation, disorders of the psycho-emotional state of a person develop with disorders of the motor, secretory, excretory, and absorption functions of the mucous membrane of the large intestine. Morphological changes are not detected in the intestine. Functional constipation is part of a group of pathologies, combined with irritable bowel syndrome, IRS. Syndrome, a combination of a single pathogenesis and various etiological, causal, symptoms. Disease as a nosological unit is always combined by a common etiology and pathogenesis. Organic constipation is associated with surgical pathologies, usually manifests in an acute form, and develops due to the innate characteristics of the intestine. In some cases, it is necessary to quickly eliminate defects. If organic constipation occurs due to invagination, scar, intestinal torsion, blockage of the intestinal lumen, or compression by a foreign body, the clinical picture develops rapidly and requires immediate surgical intervention to save the patient's life. The clinical manifestations of acute constipation are very pronounced and are relatively easy to detect with instruments. Functional constipation often has a different etiology and pathogenesis, often proceeds in a chronic form, and is not always easily curable. Most people suffering from functional intestinal dysrhythmias do not consider themselves sick. Clinicitis distinguishes 2 categories of people with ITS. Not sick, has symptoms of constipation, but does not consult a doctor for various reasons. The pathology does not significantly affect their lifestyle. Patients experiencing discomfort consult a doctor. Pathology affects the quality of life to varying degrees. Functional disorders of the gastrointestinal tract are determined on the basis of characteristic symptoms by refusal, using the entire spectrum of diagnostic techniques. In some cases, it is difficult to eliminate the symptoms of chronic constipation. For the diagnosis of functional constipation, a set of symptoms is analyzed. In clinical practice, diagnostic criteria are usually improved by laboratory, instrumental, and functional diagnostic methods. Disease description. Normal defecation is a sign of a healthy person. In various sources, norms for the frequency of defecation, the volume, shape, and consistency of daily stool mass are given. The proper functioning of the digestive system is characterized by the following features. In a healthy person, bowel movements, defecation, occur from 2 times a day to 3 times a week. Stool weight from 100 to 200 grams per day. The minimum norm is 40 grams. Stool has a cylindrical shape, like sausage. Stool consistency is light. Sometimes constipation is not associated with diseases and has a normal, random nature. However, any constipation is almost always a sign of gastrointestinal pathology, manifested by constipation and other symptoms. The presence of the following conditions in the clinical diagnosis of ITS is responsible for constipation. Excretion less than 3 times a week. Feces less than 40 grams. This action is accompanied by significant strain and ends with the release of small, round-shaped parts of the stool. In some cases, defecation can only be performed by forced bowel movements. Subjective criteria for constipation in patients with functional constipation syndrome. Feeling of incomplete bowel emptying after defecation. A feeling of blockage in the rectum. Presence of a foreign body. Constipation is not always real. It can be temporary or short-term. Intestinal dysrhythmia of accidental origin is excluded if identification of 2 or more of the above. Clinical signs of constipation and subjective sensations in patients. Duration of constipation symptoms. True constipation is diagnosed only if it lasts 12 weeks within 6 months. During this time, there may be short periods of remission. What makes constipation dangerous? Constipation is divided into 3 types depending on the degree of impact on the quality of life and human health. Compensated. Constipation does not significantly affect the body's homeostasis. Many researchers consider this stage to be the upper limit of the physiological norm. Subcompensated. The boundary between norm and pathology. Limitation to the compensated stage is considered conditional. Low or medium risk to the body. Decompensated. Pathological constipation is often associated with the disease. It has a pathophysiological effect on the body, and in some cases, morphological changes occur in internal organs. Poses moderate or high risk to the body. Causes of constipation in adults. Organic changes in the intestines. Organic changes in the intestines are not a common cause of constipation in adults. Previously, there was a notion that organic changes are only congenital and, accordingly, can cause constipation only in children. However, medical research conducted in the second half of the last century refuted this hypothesis. Causes of organic constipation in adults. Congenital and acquired intestinal anomalies. Dolichocolon, an abnormal length of the large intestine, with changes in the ganglia of the intestinal muscle walls. As a result, the passage of waste mass slows down and lengthens. Congenital dolichocolon, if left untreated, can cause constipation even in adulthood. Causes of dolichocolon in adults: excessive use of laxatives and enemas, as well as metabolic disorders of the walls of the large intestine. Megacolon, dilation of the large intestine. Expansion in adults due to the above reasons. If there are no congenital defects of the intestinal wall, stricture, atresia, then megacolon is acquired. Dolichosigma is the elongation of the sigmoid colon. Elongation and expansion, megadolichosigma. Stool masses from the small intestine are collected in this section. Acquired dolichosigma is the result of fermentation and putrefaction in the intestine, due to a sedentary lifestyle. Changes in the size and shape of this section are the common cause of congenital constipation. Accessory angle of the sigmoid colon. It is observed with an elongation of the sigmoid colon by the 2nd of March plexuses. The causes are the same as in dolichosigma. The presence of an accessory plexus leads to persistent constipation. Colonaptosis is a congenital or acquired anomaly, a consequence of colon prolapse, weakness of the muscles of the gastrointestinal apparatus. Developing in women after childbirth. It is characterized by a slowing of intestinal peristalsis and a resulting constipation, determined by aerography, radiological method by filling the intestine with a contrast agent. Transversoptosis, the prolapse of the transverse colon into the pelvic region. Normal location in the projection above the umbilicus. Transversoptosis is accompanied by pain, intestinal obstruction, impaired innervation, and consequently, constipation. The development of this disease is triggered by lordosis, scoliosis, and other spinal curvatures. Isocentral valve insufficiency. The ileocecal valve is a morphological formation at the junction of the small and large intestines, which prevents the contents of the large intestine from passing into the small intestine. Congenital and acquired anomalies are distinguished. Clinically, it is accompanied by specific symptoms, in particular, constipation and diarrhea, which are observed sequentially. Diverticulosis of the sigmoid colon. A diverticulum is a hernial protrusion of the intestinal wall resulting from dystrophic processes in the wall of the large intestine against a background of high pressure. It usually develops in people over 50 years of age. The clinical presentation is characterized by a tendency to constipation, anal bleeding, meteorism, frequent discharge of intestinal gases, pain and heaviness in the left side that passes after defecation. Organic causes of constipation in adults can also be adhesive inflammation, acute intestinal obstruction. 2. Functional intestinal diseases. Functional intestinal disorders are one of the common causes of constipation in adults. Intestinal obstruction of functional origin is a form of colon dyskinesia. Dyskinesias can be accompanied by diarrhea and/or constipation. The dominant dyskinesia in the pathogenesis of constipation is divided into the following forms. Atonic, the result of pathological relaxation of the smooth muscles of the intestine. Spastic, due to reflex spasms of the anal, sphincter or other part of the large intestine. In clinical practice, difficulties arise in distinguishing between atonic and spastic constipation, since the factors causing their manifestation interact. At the same time, atonic constipation occurs mainly in the following categories of people: those who lead a sedentary lifestyle, being in a state of depression due to mental illnesses and various psychomotor disorders, consumers of high-calorie products, often containing animal proteins, regular suppression of the natural urge to defecate. Spastic constipation is usually observed in individuals with the following conditions: problems with the anal sphincter, cracks, hemorrhoids, and dysfunction of organs leading to reflex intestinal spasm. Signs of chronic poisoning with heavy metal salts, endocrine diseases, autoimmune thyroid diseases, diabetes mellitus. Chronic diseases in the anamnesis and long periods of treatment with drugs that disrupt intestinal function, including antibiotics. Antibiotic constipation. The use of antibiotics, of course, leads to dysfunction of the intestines. In some cases, a side effect of antibiotic therapy is constipation. The pathogenesis of this is not fully understood, possibly due to disruption of the main functions of the large intestine. Main physiological functions of the large intestine: formation of fecal masses before defecation, participation in defecation, reabsorption of electrolytes, water. This function of the intestine is unique. Absorption of water occurs only in the large intestine. The saprophytic microflora of the intestine forms. The endoecological biocenosis. It performs the functions of intestinal physiological activity: hormone synthesis, neutralization of metabolites, and activation of the immune system. Thus, the combination of prolonged use of antibiotics, 30 days or more, with dyskinesia in the form of constipation is due to physiological activity of the intestine decreases due to intestinal dysbacteriosis. Water reabsorption increases, leading to the formation of anhydrous chyme, slowing of the peristalsis of the large intestine and, as a result, retention of the contents of the large intestine. Constipation treatment. The main directions of therapeutic and preventive measures in the treatment of constipation are elimination of negative factors, changing lifestyle, restoration of the natural defecation reflex, organization of regular classes, adjusting the diet, adding fiber to the diet, treatment with laxatives, physiotherapy, intestinal massage, electrostimulation. The first 3 points of the treatment strategy depend on the patient. Addressing the patient's surrounding problems can play a significant role in improving their living conditions. When organizing physical activity, it is recommended to pay attention to the specific characteristics of the body. Regular walks in fresh air are shown. If you have a sufficient level of physical fitness, you can run and swim. Cycling is contraindicated. Regarding constipation diets, it is recommended to include fruit nectars, preferably from fruits common in the patient's area, dairy products, mineral waters, vegetable oils and butter, boiled wheat and rye bran, which are permitted for use during the acute phase of the disease. In inpatient settings, the third special Pevsner diet is usually used. Important factors in the regulation of defecation. Observe the order, eating at the appointed time. Drink sufficient fluids, up to 2 liters per day. Abdominal massage, clockwise rotational movements. Formation of the correct defecation reflex, simultaneous visit to the toilet. In comfortable conditions, without rushing. In a comfortable position. Drug treatment. Despite the abundance of over-the-counter medications, it is important to remember that they should be selected correctly and used according to prescriptions. By the mechanism of pharmacological action, laxatives are divided into 4 groups. Drugs that have a laxative effect by stimulating the receptors of the large intestine. The therapeutic effect is observed after 6 hours. The administration induces a single defecation. Preparations capable of retaining intestinal fluid and softening intestinal contents. Medications to increase intestinal contents, which help with fecal mass deficiency. Oils, e.g., pumpkin oil, which have a sliding effect and facilitate stool passage. Physiological procedures for constipation are used as prescribed by a doctor. Intestinal electrostimulation is an effective method, the principle of which is the replacement of nerve impulses that cause intestinal peristalsis with an electrical signal in a certain repeated rhythm. The procedure improves blood circulation and intestinal motor function. Massage for constipation. There are the same limitations as with an electrical stimulant. Specialists who have undergone special training are allowed to perform massage. IMT, monitoring cleansing of the intestine. Controlled procedure for removing stones in the intestinal lumen. It has no effect on the beneficial flora of the intestine. Sometimes bifidobacteria are prescribed along with the course, indicated for certain forms of constipation. To prevent constipation, eat regularly and differently, including as many fiber-containing products as possible in your diet. Avoid frequent use of laxatives, as addiction to them can develop and the intestine loses its natural ability to defecate, and in extremely severe cases,